The gentlewoman from Washington is recognized for 5 minutes.
Thank you, Mr. Speaker. The underlying bill importantly recognizes the role and sacrifices of firefighters. And yes, it's our firefighters who often volunteer to help protect our greatest asset, our children. Yet they face a growing threat of liability lawsuits related to the proper installation of car seats. Each year, nearly 2,500 children under the age of 14 die in car accidents, and more than 200,000 are injured in motor vehicle accidents. In 2005, half of those who died were not restrained. According to the National Institute of Highway Safety, children that are restrained in child seats have an 80% lower risk of fatal injury. The good news is that we're doing better as a country in using child seats and saving lives. This may have something to do with the fact that all 50 states and the District of Columbia now have child restraint laws on the books. Yet, it's estimated that 25% of kids are still not restrained. We're making great progress in ensuring child safety seats are used to protect our nation's greatest asset. However, even though more children are using child safety seats, improper installation or improper use of a child safety seat can have the same fatal consequence. As a new mom, this is a scary reality, and I think, like many new parents, I fear that we haven't installed our child safety seat properly. A recent study in 6 states on the misuse of child restraint systems concluded that nearly 75% of child seats had at least one critical misuse. In an effort to reduce the misuse of child safety seats, many fire departments send personnel to a 32-hour, 4-day course on the proper installation and use. Once these personnel have been trained, they're able to provide inspection services or advice on a voluntary basis regarding the proper installation and use. When my husband and I had coal last year, we were advised to have a fire department ensure our seat was properly installed. But I've also heard the stories of people being denied by their local fire department due to liability concerns. One example was in Eaton Rapids, where new parents, John and Carol Doyle, like many parents, were nervous about the new responsibility for the health and safety of their new baby. And it began with that first ride home from the hospital. They had a pretty good idea how to strap their rear-facing infant car seat into the back seat of their car, but they didn't like the idea of guessing. They sought help from the people at the local medical center, but those folks declined. They were afraid that if they told us how to do it, then there would be a problem. We'd sue them. So the medical staffers suggested that they seek help from the fire department. So on the way home from the hospital, they stopped by the fire station. And the woman wanted to help but couldn't. It's a liability issue, she said, referring the family to the local police. They called the police department, but the person they spoke to said, again, it's a liability thing. This is an important service that can help save the life of a child. However, the fear is that some departments and communities may be unwilling to offer this life-saving service because of fear of liability. The motion to recommit I offer today would help remedy the situation. It would protect fire departments that wish to offer this service to the public. The language requires states or local governments covered under the provisions of this bill to protect their properly trained firefighters from liability and lawsuits when they offer inspection and advice regarding car seat use. This motion to recommit gives states 2 years to provide protection for our firefighters. This service the firefighters are offering is too valuable to let it get bogged down by the threat of lawsuits. We should not allow trial lawyers to hijack the safety of our children.